Happy New Year and welcome back to Rural Health Today, the podcast where we connect you to what really matters in rural health. I'm Kyrsten Newlon, Director of Marketing at Hillsdale Hospital and the producer of our show, Rural Health Today. I'm so excited to make a quick appearance here today to talk a little bit about what we've done in 2025 with Rural Health Today and what you can anticipate in 2026 for our new year of podcasting. The year started out with a few recaps of our time recording Rural Health Rising, including highlighted topics like cybersecurity, health policy, and the future of outpatient care models, as well as our special guests, including innovative hospital leaders like Jason Merkley from Brookings Health, Dr. Ramsey from Surer Health, and rural health trailblazers from across the country, such as Lisa Davis from the Pennsylvania Office of Rural Health, and John Supplett from the American Hospital Association. On February 13, we published our End of an Era episode concluding the podcast time as Rural Health Rising and ushering in a new era introduced the following month with our first episode of Rural Health Today. From there, we started publishing our Monday news updates, shortening our guest interviews, and introducing brand new segments like Rural Health Answers. We also incorporated rural health recommendations into the end of every guest interview. If you want to check out all of our great guest recommendations from 2025, download the PDF at ruralhealthtoday.com. Our news episodes this year followed a variety of topics, but the most recurring headlines were the legislation for Medicaid and other healthcare funding cuts, hospital closures, healthcare job layoffs and committee shutdowns, changes to the 340B program, and the wide-reaching effects of administrative burden and funding changes for our industry. However, we also shared success stories to conclude our news episodes, new care models providing better access for rural areas, programs to support the healthcare workforce, efforts to improve community mental health, breakthroughs for cancer and surgical solutions, and so much more. Another change we made to our podcast this year was adding seasons to provide deep dives into specific areas of rural health. Our first season was Rural Health and Maternity Care, a series of episodes about maternal care access in rural America. Our guest list included Adrienne Griffin from the Maternal Mental Health Alliance, Carrie Cochran-McLean from the National Rural Health Association, Harold Miller from the Center for Healthcare Quality and Payment Reform, and Dr. Maria Music from the University of Michigan. Throughout this series, we explored the state of maternal health care and what needs to happen for mothers and babies in rural areas to have the access to care they need. Our guests discussed perinatal psychiatric wellness, maternal sepsis, the impact of health policy, and what it means to be a birthing-friendly hospital. The Rural Health Today team intentionally chose this series to be our first deep dive of the podcast relaunch because of its vital significance in the health of our rural communities. Our second season was Rural Health Summit, which aired over the summer to showcase Michigan's healthcare leaders. We actually recorded all of these interviews in a single day, but they're packed with insights into the current state of healthcare funding, policy, and what it will take to keep hospitals open through the coming challenges. We are so grateful to the industry leaders that have offered their voices to our show this year. We can't thank everyone individually, but every single guest has provided a perspective that's unique and valuable to our content. There have been several agencies and organizations that have been incredibly supportive of our work promoting awareness around rural health issues. Thank you to the National Rural Health Association, American Hospital Association, Michigan Health and Hospital Association, Becker's Healthcare, and the many news sources involved in the research of our discussions. Lastly, we'd like to give a few quick hints at what's coming next. Over the next few weeks of 2026, we'll publish some exciting guest interviews featuring data experts, political affairs leaders, and voices at the forefront of the great funding debates of our industry's era. Then we'll announce our first season of 2026, which has been in the works for many months behind the scenes. Be sure to stay tuned on your favorite podcast platform as well as the Rural Health Today Twitter account and YouTube channel, so you don't miss the upcoming announcements. In 2026, we also plan to answer more listener questions, bring brand new voices onto the show, and walk our listeners through what's front and center in healthcare headlines every week. Before we close out this episode, we have a few acknowledgments to make. Thank you to the Health Podcast Network for helping us rebrand and relaunch our show. The expertise and talent that Dan Kendall and his team have contributed to this podcast is unmatched. And if you like Rural Health Today, check out the other podcasts that are a part of this platform at healthpodcastnetwork.com. Thank you to our audio engineer, Kenji Ulmer, for his fantastic work editing our audio, especially as we expand to 2 episodes per week and incorporate new seasons and segments. We appreciate his dedication. Thank you also to the Hillsdale Hospital marketing team who provides the research, writing, production, and technical support behind the scenes. Specifically, thank you to Vanessa Brown and Annie Pettit. Lastly, we can't close out the podcast without thanking the most important part of this industry, the nurses, the doctors, therapists, paramedics, techs, and every other kind of healthcare worker in the trenches providing patient care. At the end of the day, all of this is about you. Your sacrifice, your devotion, and your passion for the patients you serve means everything. Our hope is that Rural Health Today serves to help hospitals across America find solutions, form partnerships, and overcome barriers so that every patient has access to the care they need. Thank you, our audience, whether you're a loyal fan or occasional listener, for joining our conversations about rural health. There's nothing we love more than hearing from you. If you love the show or want to ask a question to be answered by a guest on the podcast, get in touch with our team. You can rate the show, leave a review, or email Rural Health Today at hillsdalehospital.com with questions and guest recommendations. We also have a form on our website, ruralhealthtoday.com, to submit your questions and comments about rural health. Our goal is to tailor the show to address what's most important in rural health, and we rely on our listeners and guests to help us find that direction. Again, thank you for your engagement in 2025. We hope you can join us for some exciting conversations coming up soon in 2026. And remember, rural health strong.
And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kyrsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.